course, the clinical evidence, look at the probiotic, whether they have a clinical trial done or not. So probiotic must be proven based on the mode of therapy. Probiotic that being used to prevent disease are not the same as the treatment of the disease. And then viability, effectiveness, safety, and so on has to be, you have to bear in the clinical trial. So find the probiotic that are clinically tested. So that is actually important. So you have to know that if they are using multi-strain, so look at the clinical trial that use the whole strain and not a single strain. It has to be like that, yeah. Because from this study, there are 3 factors that are talking about again: the mode specificity, whether there are strain specificity, and disease. So not all disease, as I said, use the same probiotic. So example of the evidence-based probiotic, of course, from the HexBio product. So how we end up with this, because we want to check which probiotic that fulfill all the 6 qualities that we want. So that is where we end up find this HexBio. They are in the form of microbial cell preparation, combination of the 3 lactobacillus and also 3 bifidobacterium species. And this HexBio are backed by 20 clinical studies. So it's not only our group. I think University Malaysia, University Putra Malaysia, University Science Malaysia, they are all in here. So they are actually have used this product for their clinical trial. So we use actually randomized placebo-controlled trial for all the patients, where the patients and also the investigator expose the content of the placebo or the probiotic. So as I said, the multi-strain probiotic, and here we have 30 million CFU that contain lactobacillus acidophilus, lactis, and also cassia. And bifidobacterium, you have longum, you have the bifidum and infantis, and this we did a clinical trial using 1 sachet twice a day. For instance, in the case of post-gestational diabetic, we use 3 months. For the colorectal, post-surgical colorectal cancer, we use 6 months, and non-alcoholic fatty liver disease, we use 6 months as well. And there are cases of the, I think some of these clinical trials done elsewhere, not our group, they use 7 days for pre-surgical and critical illness. So this just to share with you the publication related to the anti-inflammatory effect of HexBio. What is amazing about this is that post-surgical, a month after the surgery, we put them on the probiotic. So their duration of the stay in the hospital is much less. Not only that, they reduce the pro-inflammatory cytokine in the patient, which is actually amazing. But what happened in the placebo, the pro-inflammatory cytokine is significantly increased. So not only probiotic is safe, we got some resistance from surgeon because they thought that probiotic is not safe. But from our study and I think elsewhere, probiotic is actually safe for colorectal cancer, or even the who actually underwent the surgery for colorectal cancer, and or also chemotherapy. So patients with constipation, we have tried patients with like wound breakdown and all that. We actually use this as the precaution for them to actually less complication. So another study, but this is not our study, they are also looking at the colorectal cancer patients on chemotherapy, and this supplement is just for 4 weeks, and they look at the level of interleukin, TNF-alpha, and C-reactive, and they found that, of course, the patient post-intervention for the probiotic is significantly reduced by 39%, and for placebo is increased by 99.7%, which is actually interleukin-6 marker is quite consistent in this study. So non-alcoholic fatty liver disease is another thing that we are actually focusing on. We are actually testing the gut-liver axis. The gut would affect the liver metabolism and cause fatty liver. And so what we did is we get the small intestinal mucosal biopsy from this patient, for all the patients, and then pre and post, and then give them the probiotic, and then ask them to eat the probiotic for 6 months and measure various things. So we have published quite recently. So from this, we actually showed reduction in the inflammatory markers measured on the NAFLD patient we had spiral supplementation for 6 months. And it shows that reduced 89% of the interferon gamma, reduced 40% of TNF alpha. Not only that, we are also looking at the dysbiosis, which means that we sequence the gut microbiota before and after. We also look at the intestinal lining, using the immunohisto, looking at the intestinal barrier protein and so on. We actually, and then lastly is of course the blood for the cytokine. What we found from this study is probiotic supplementation for 6 months is actually restore the intestinal barrier function, which actually it helps in the gapping and holes. It become less in the tight junction and also gap junction. It prevents the leaky gut, of course, and it reduces the inflammatory cytokine as evidence, and that overall helps in the reducing the inflammation. Not only that, we further look at the patients who are at risk of type 2 diabetes. If you look into the journal, probiotic and type 2 diabetes, there will be thousands of papers on that. But what we are actually focusing is people who are actually asymptomatic, they are healthy like us, but they have diabetes during pregnancy. What we did is postnatal 6 months, we asked them to take the probiotic for 12 weeks, and then we measure pre and post intervention. From this study, amazingly, we had 25% of the C-reactive protein is reduced, and interleukin 8 reduced by 39%, which is actually amazing after 12 weeks. So what else? The clinical evidence that probiotic actually enhance recovery for post-surgical and illness recovery. This paper is actually looking at I think the paper from UM, they are looking at the post-surgical complication, and they're trying to reduce the complication. What they did is they asked the patient to consume probiotics 7 days prior to the elective abdominal surgery, and time to return to the normal gut and the duration of the hospital stay are the main parameters. So what they found is return to the normal gut functions is actually 31% faster, and then duration of the hospital stay is actually 51% earlier, which is actually amazing. So not only you help the patients to recover, faster, you are also increase in the nutrient absorption, increase in the calorie intake and so on. Another study, but these are actually on the critically ill patients on the enteral feeding. Again, they are taking the probiotic, improve the overall outcome of the ICU patient. Again, they are actually looking the same. 57% are going faster in the return of the normal gut function and the duration of the ICU stay